Welcome to the Dermastore Podcast.
A chat about all things skincare, skin health.
And if you're a real skin nerd, we hope you'll join the conversation. Welcome to the 12th episode of the Dermastore Podcast. Hey Lara, how are you doing?
Good morning, Greg. I'm fab. How are you?
Very well, thank you.
Good. How's your week?
Yeah, it's been busy, but good. Excuse if you hear any sort of planes diving. We're quite close to the Stellenbosch airfield here, so that would be the buzzing noise in the background.
And the window's open because we have
load shedding. Yay.
Awesome.
What did you use this morning?
I did a cleanser that we're testing at the moment for upcoming possible launch. It was great.
I think I used the same thing.
Awesome.
Yeah.
The gel version.
The cream version.
Okay. And then I used my Abaji vitamin C serum. The team, we're rotating the Abaji serum.
Nice.
So we were using 10, 15, 20. So I used the 15 this morning. And then I used the Kiehl's Ultra Moisturizing Lotion this morning on my skin with Huxley Stay Sun Safe SPF 50. Yeah.
Good one.
What did you use this morning?
I used the Zoe Dual Action Scrub in the shower. Very nice. I'm not super into scrubs, but I really like that one. Same cleanser as you that we're testing from a brand, and then I use Silymarin CF from SkinCeuticals. Yeah. And then I actually use the new Endocare moisturizer, which hasn't launched yet, but maybe by the time this podcast comes out, it would have.
And how was that?
Very nice. I like it.
Okay. Do you feel more youthful?
I wouldn't say just yet. I mean, I've used it for like 4 days, but it's a lovely texture, I must say. And then Active D Fluid.
Fantastic.
Yeah.
Your favorite.
Okay,
awesome.
Cool. So we're going to chat about acne today, and we have Dr. Webster in the podcast studio joining us. How are you, Dr. Webster?
No, I'm well, thank you.
Good. So obviously a huge topic. We're going to try and keep it light and really go through the main kind of causes, who gets acne, and jump straight into treatments as well. Because we know obviously there are a ton of ways to treat this thing. But starting out, what is your number one piece of advice when it comes to acne? Just top level.
Number one, especially if there is a family history of severe acne, the young teenager should come early for treatment and product recommendations.
Early treatment. Perfect. Okay, so who gets acne, and I mean, is it something that affects only certain people, or does everyone at some point during their life get some form of it?
Well, most teenagers will get acne. About between 75 to 80% of teenagers will get acne.
Okay.
But it does often go into adulthood as well. So adult acne is also reasonably common. There are various statistics about it, but between about 15 to 35% of adults will also develop acne. So it's actually quite common.
Wow. Okay.
And is it more common between men and women, or is there...
I think adult acne in women is more common. Often if there is a hormonal component to it, if there's hormonal imbalance or perimenopause, it tends to, certainly in my practice, I see it seems to be more common in the adult woman.
And one thing just quickly on who gets acne, is it true that we're starting to see acne in younger patients nowadays?
It does seem to be, certainly in my practice, I see often it can be 9 or 10-year-olds that present with acne. It does seem to be in younger patients.
Okay, so we have a kind of general understanding of who gets acne. What are the causes of acne?
Number one, it is genetic factors. So if there is somebody in the family who's had more severe form of acne, their children are more likely to get that form of acne, the nodular cystic acne that can produce scarring. And all acne is hormonal. So it often does start off with puberty and is related to hormonal imbalances in women. The other thing is certain medications can cause acne. Injections, Depo-Provera injections that contain progesterone, that can cause acne. Stress can definitely cause it. Diet, a lot of the studies were done a long time ago with milk. They showed that if you had an excess intake of milk, dairy products in teenagerhood, your acne would be more severe.
And that age-old myth of if I have a chocolate?
Well, not specifically chocolates, but refined sugars. So refined sugars can make acne worse. Not specifically, I don't have any studies about chocolate itself, but certainly
if
you're eating a lot of, say, Cook Sisters or something.
we are definitely localizing
So
this.
diet could, and then also we get what we call pomade acne. So if you're using very greasy, gooey things on your skin,
So would that be like comedogenic products?
Yes, exactly.
Okay. Do you have an example?
like Vaseline?
Okay.
Or you're using.
So slugging as a teenager is probably not a good idea.
No.
Keep that trade for later.
Yeah.
Okay. So the causes of acne, these are the triggers that are now going to lead us to the types of acne that we could experience. And some are mild and some are quite severe. Do you want to take us through what types of acne we get? And maybe we can link the type of acne to the possible treatment that we could use for that type of acne.
Yeah. So there's very many different classifications about acne, but I like to keep it fairly simple.
Okay.
And the three groups that I like to sort of think about, because it is linked to the treatments, is what we call comedonal acne. Mm-hmm. And that tends to occur in the younger patient where they get seborrhea and they get blackheads and whiteheads. So that's a comedonal acne and a few little pimples. The next stage is papular-pustular acne, where you get deeper pimples and bigger pustules. And then the most severe type is what we call nodular cystic acne, where you get cysts and scarring. And those are the three big groups. You can also get truncal acne or acne on the trunk. That's also a slightly different group, but I like those three big groups.
The most common.
The most common, yeah.
Okay.
Yeah.
And so let's link the treatments then. So if a patient presented with comedonal acne or blackheads, what would be a suitable treatment for that patient?
Well, number one is to use the correct cleanser. So often I will like a slightly foaming cleanser and maybe exfoliation or a scrub maybe sort of once a week or so. And then often at that stage to use a retinoid at nighttime is essential. So obviously there's prescription retinoids and then non-prescription retinoids. So you've got a wide choice, but that's the sort of mainstay of the treatment at nighttime. And then if there are little pimples in the morning, is to use something as a spot treatment. You can use benzoyl peroxide, azelaic acid, salicylic acid, and various treatments like that.
And you can start the retinols at any kind of age, or what age would you say?
At any stage.
Okay.
As soon as you see those blackheads and whiteheads, you can start.
So 11.
Yeah, 11.
Wow.
Something that you have mentioned before is there's no need to go so extreme. So the appropriate treatment for the appropriate type of acne.
Exactly.
Going on to an antibiotic or isotretinoin for comedonal acne and one or two pimples.
Overboard.
Overkill, exactly.
Definitely. And you get the concept of what we call microcomedones. So you get small little blackheads and what you can't even see. And that's where you want to start the topical retinoid. Whether it's a prescription like a Dapiline or whether it is a retinol. But you want to start early. As soon as you see that seborrhea and those very early comedones, you want to start the treatment early.
And extractions. I mean, this is where your professional skincare therapist plays a very important role, to have professional extractions. That really is that mechanical removal of blackheads is the best form of treatment for those.
It is. So you get two types of comedones. So we get what we call open comedones, and that's a blackhead. And that's where the topical retinoids work brilliantly for that. But the closed comedone or whitehead, the little opening is so tight, it won't come out, even with isotretinoin. And that's where you do need a physical extraction. A skin therapist needs to physically open up that closed comedone. Or else you can do something like an eclaira, which is a machine that's got IPL, and it's got a thing that sucks out the blackheads and the whiteheads.
Oh, wow. So it's like a dual treatment.
Yeah, so it's got anti-inflammatory properties as well as it does comedone extraction.
That sounds amazing.
And it's very important to treat these, because I always say to my patients, every blackhead and whitehead will eventually become a pimple. So that's where you want to start that treatment early.
And the frequency of those kind of treatments, I mean, what do you recommend?
Well, I would say for extraction, say 4 to 6 weeks.
Okay.
To go regularly for treatments.
That's manageable, 4 to 6 weeks.
But you need to combine it with a topical retinoid at night time.
And your foaming cleansers and
Yeah, and then obviously also make sure you're using the right sunscreen. You're using oil-free matte sunscreen. You mustn't go using a sunscreen that's clogged the pores and make things worse.
So on Dermastore, we've actually got a landing page for our sunscreens, and you can shop by oily acne prone by the skin type that you have. So take a look there. If you do have oily acne prone skin, then check out that section.
So moving on to now the next stage of acne, our papules and pustules. What's the difference between the two?
Well, again, you're just getting deeper. You're getting deeper red bumps. A papule is a red bump, and then a pustule is one it's like a pimple, yellow with a yellow head.
And so when you say red, that's obviously indicative of inflammation.
Exactly.
So now this is when bacteria has started to join the party.
Exactly.
Okay.
And that's where, again, you could use something like the Eclaira, which has got IPL, which has got anti-inflammatory properties, and it does the comedone extraction. So that's quite useful. And then this is where the stage where you could consider using oral antibiotics like oral tetracyclines. But the problem with that is you can develop bacterial resistance, and we generally worldwide it's recommend you don't use the oral antibiotics for more than about 4 months. So it's more of a temporary thing.
So it's very case-specific kind of treatment. You're going to diagnose the kind of the patient's needs, and maybe at a certain point in their life where they don't want to go on
isotretinoin.
Sort of stronger treatment, but just knowing that it is temporary.
Yeah. It's a suppressive treatment. The only treatment that is curative is isotretinoin.
Right.
Roaccutane?
Yeah.
Okay.
Or Orotan, there's various trade names. So often what I will do is a teenager might come and see me in the summer. They're cricketers or lifesavers, or they're out doing summer sports, and I can't put them onto isotretinoin. So that's where I'll give them oral tetracyclines for a couple of months just to tide them over the summer months. And then I will say, come and see me. Well, in South Africa, our winters are sort of April to September, but come and see me the end of March. At the end of summer, we look at it again, and then we can consider isotretinoin over the winter months.
Yeah, I mean, just so people understand, isotretinoin wouldn't be used over summer because it makes your sun photosensitive.
Yeah. So isotretinoin makes you photosensitive.
Right.
Especially if you're a sports person. I mean, if you're indoors and play computer games, then you can use it.
So on oral antibiotics, and what about topical antibiotic treatments?
So topical prescription antibiotics also need to be limited. There are things like clindamycin. Again, they are useful for a short period of time, but again, you can get bacterial resistance. And definitely you don't want to combine a topical antibiotic with an oral antibiotic. Overboard.
Yeah.
But that's where products like we've got on Dermastore, non-prescription products like azelaic acid, benzoyl peroxide, tea tree oil, niacinamide, all those ingredients are fantastic because you don't get bacterial resistance. You don't want to get bacterial resistance.
And why we love those ingredients so much is they're multifactorial. We speak about it all the time. That azelaic acid is not only great for that papule pustule, but it calms inflammation of the skin as well. It prevents post-inflammatory hyperpigmentation. So these ingredients are helping more than one benefit, not just the bacterial infection.
Exactly. Like niacinamide helps with your barrier function. So often a mistake teenagers make, they sort of want to scrub away the acne, so they end up with an irritant contact dermatitis. And also what's nice is like on Dermastore, we've got Martyderm, the acne over sick event, which has actually got tranexamic acid in it. It's the only one anti-acne product that I know of that has got tranexamic acid, and that will help for post-inflammatory pigmentation.
Amazing.
Which I think is a great product. It's a great product.
So just to round up here, the mild comedonal acne is topical treatment based. It's got less inflammation.
Yes, yeah.
So you're going to use your topical treatments. That's usually at a younger age, teenage sort of stage. And then as it progresses, the moderate to severe acne or papular pustular acne, that's where you could look at other things, including antibiotics, topically, orally, limited though. And now we would look at something like, if things got really severe, the next stage is the nodular cystic acne. What are your treatment options?
So for nodular cystic acne, that is where isotretinoin is the treatment of choice. So in this day and age, nobody should end up with permanent scarring. So that's where isotretinoin, there's various trade names, Roaccutane, Orotan in South Africa. So it's a wonderful drug. Of all the drugs that I prescribe in my practice, is one of the most satisfying because you see teenagers become depressed, they've got terrible skin, so they're miserable, socially withdrawn before you start the isotretinoin, and sort of 6 or 7 months later, they've got a smile on their face.
And what I love so much, because I have been a patient on Roaccutane, and of course the short-term side effects of the dry skin, the redness, the flaking, it is uncomfortable, but it's more about the long term.
Exactly.
It's the rest of your life that you won't have acne again, because you said, Roaccutane puts acne into remission, or 80%.
Yeah,
90%.
but 85%. After one proper course of isotretinoin, there's about an 85% chance that the acne will stay away and won't come back to the same severity.
So it's just that treatment for 4 to 6 months, grin and bear it, because for the rest of your life.
But it's so linked to psychology as well. I mean, skincare, skin health, if you've got a really bad skin, it affects your confidence, you know.
Definitely. It's the quality of life index. They've done studies. And that's why a lot of people think, oh, you know, that person's got bad acne. They're not washing their face properly. It's not their fault, you know. So that's why they feel bad about it.
Or just suck it up and just deal with it. It's an age and stage thing.
Exactly.
But actually, you know, as children, especially kids, are developing and growing into their own sort of confidence, it's very important, you know, that they feel good in their own skin.
Yes, it has a huge effect. And as I say, unfortunately, sometimes I find some fathers, especially if they haven't had severe acne, they will say, this is a stage you must go through and you must just, as I say, suck it up.
Like a rite of passage.
It's a rite of passage.
Yeah.
Well, I disagree with that completely.
I remember, I went on isotretinoin when I was maybe in my teenage years, and it has a huge impact. You also just after the treatment, you feel so good. Your skin's all clear, and you know going forward, it's almost like you don't have to worry about it. It's the same with having braces as well. That day the braces come off, you feel so good. It's the exact same thing, you know.
Yeah.
So you can definitely, you have to sympathize with people with acne, severe acne, and know that there is treatment available.
Yes, definitely.
And what I love so much now as well is we also have the topical products to help remedy the dryness, the sensitivity. So we can help alleviate some of those symptoms while you're on isotretinoin.
Exactly. And I think that's why there's so many sort of myths about isotretinoin, that they went through a horrible experience because it wasn't explained to them properly what products to use while you're on isotretinoin.
Well, you always talk about that. You counsel your patients.
Yeah, you've got it. You obviously will have dry lips. Your skin will be more sensitive to the sun, but you should be able to manage it quite easily with the right products.
Yeah. And our skin therapists are all really well educated and up to date on what the most relevant product would be while you are on isotretinoin. And something also really important to note that post your course of isotretinoin, that the drug will still be in your system for up to about
30 days.
Okay.
Yeah, about 30 days.
So kind of continue that routine for at least another month or so.
And I think what's also important, although you will get acne remission in about 85% of patients, although the drug's out of your bloodstream after 30 days, it has an effect on your oil glands for about another 3 to 4 years.
Awesome.
So it's unlikely to come back in the next 3 to 4 years to the same extent. But what happens is, you see it clearly in my practice, that maybe after a year, that seborrhea, that oiliness comes back, and you get, again, the microcomedones start coming back.
Okay.
And that's where you've got to hit it with a retinoid.
Okay.
And that's where you, again, a topical retinoid, either a prescription one or a retinol or a retinol esters.
But we love retinoids anyway because you're going to start anti-aging.
Exactly.
So let's do it.
And I think also an important thing is just to say, obviously you can start isotretinoin at any stage of life. You were just mentioning before this, we started, that you had a 70-year-old patient.
Yes, recently I had a 70,
phenomenal.
I think he must have been 75, gentleman, and he said, "Doctor, I'm now tired of the pimples." And unfortunately, the more severe forms of acne will start younger and go on longer.
If not treated correctly.
If not treated correctly, yeah. So I gave him isotretinoin at the age of 75.
That's amazing.
And he was so happy.
I think a lot of women struggle with it as well, and, you know, adult women. So do you recommend like a low dose?
You sometimes do give a low dose.
Okay.
You sometimes do give a low dose. I tend to give the proper dose, but more recent years I've given a lower dose with less side effects for a slightly longer period of time.
Right.
But we do sometimes give a low dose.
And do you have any final tips or any closing points on Roaccutane for your patients and then overall acne?
Well, I think with isotretinoin, because the prices with the generics on the market, the prices have come down. I think it's a powerful drug. It needs to be given under proper supervision. Unfortunately, sometimes it is prescribed, like Smarties. It's not Smarties. It's a powerful drug. You need to have blood tests beforehand, and women must not fall pregnant, obviously, while they're on it, and for 30 days afterwards. It's got to be under proper supervision.
Okay, fantastic. And actually something you just mentioned that reminded me, hormonal acne during pregnancy. And so this is quite a common concern with pregnant women. And we do have our podcast on pregnancy, of course, but there are some products that you can use for acne while pregnant. So we do have our landing page, and we do try identified on the product pages themselves that it is safe for pregnancy. So you can still help alleviate those conditions while
Totally,
pregnant.
very good point. And also just reach out to our therapists. They get this question on the daily. So I think that covers everything. I'm very happy that we've gotten to this topic. It's a big one, but we're always available to answer your questions. And yeah, if anything else comes up, please send us an email.
Don't forget to subscribe if you're keen to learn more about what we have to say. We would also really love your thoughts, ideas, and any questions you have for future episodes. You can email us on pod@dermastore.co.za.